Good evening, everyone, and thank you for coming out today and viewing us virtually for our very first mental health symposium event that we're having. The month of July is BIPOC Mental Health Month. I actually more recently learned about this month myself because, we always talk about just general mental health month. And, it's definitely awesome that we have an opportunity to really speak to the community and to really foster an opportunity to have conversations about mental health. So I am Selvena Brooks-Powers. I'm the councilwoman for the 31st District. And I'm proud to be here tonight to host this important discussion on our community's mental health needs. It is great to be joined. I see we have our district leader here, Valerie West. Thank you for coming. And I'd like to thank St. John Episcopal and their wonderful staff for hosting tonight's event and being a community partner. I'd also like to introduce and thank at the same time our set of panelists representing New York City Mental Health, New York Hope, Health and Hospitals, and the Joseph Adabo Center for participating in tonight's discussion. Especially in the wake of the COVID pandemic, we know in Rockaway we were hit first, we were hit hard. Our health has never been more important. It's a conversation that has now come to the forefront. It should have really been at the forefront, but COVID has now allowed us the opportunity to really to foster these spaces. And communities like ours, particularly communities of color, have faced serious healthcare inequities for many decades. The pandemic has exacerbated these inequities, and they did not quite honestly start with COVID, nor will they end with COVID. So this is especially true for our mental health, which can often be stigmatized or invisible to others, which can make it extremely difficult for people to reach out for help. And mental health conditions can have cascading impacts on other parts of our lives. They can make it harder for us to care for our physical health, maintain employment and relationships, and to lead stable lives. So it's extremely important to me that we engage with this topic as a community to have a frank and honest discussion about how to tackle these issues head on and acknowledge the impact they can have on our neighbors and our loved ones. We'll discuss what types of resources are available to constituents from the city and other service providers. We'll also review best practices for identifying a crisis and how to help a family member or neighbor in need. I'm excited to be able to, again, have the conversation. I recently had a discussion around mental health with one of my colleagues and talking about how far we've come when we talk about mental health and how we've started to really remove the barriers when discussing mental health, especially in communities of color. It's a lot more access to resources. So I hope that in today's conversation, we can really bring to the forefront what those resources are, how people can tap into them, and how we can be able to practice good mental health care as well. So thank you for being here as a part of today's discussion. Vanessa Caesar from my team is going to be our moderator, and I'm going to be coming in and out of the conversation. But thank you again for being a part of this. Thank you everyone who is here physically and virtually.
Thank you, Councilmember. We definitely appreciate all of your work and support around mental health, which is why we are here on tonight. I think it's best if I pull this down. I don't want to make, I know, in the wake of what's going on with COVID right now, I just think that is better if everybody can hear me. So in creating tonight's panel discussion, we sat around with our team and we realized that as it pertains to all of the calls that we receive, that it's very important for us to have this conversation in our district and support the community with information, resources, as well as highlighting the importance of mental health, especially for people of color. And on tonight, I am very excited to be joined by the Vice President of Behavioral Health here at St. John's Episcopal Hospital, Terri Coyle, who is at the end of our panel at the moment. And then we have our New York City Department of Health and Mental Health and Hygiene, Hazel Phillip. And respectfully, if you both can just introduce yourselves and the amazing work that you do every day.
Hi, I'm Terri Coyle. I'm the Vice President of Behavioral Health here at St. John's. I've actually been working at St. John's for quite some time. I've been here over 20 years, very dedicated to St. John's and to the community here. I started here as a social work assistant, became a licensed clinical social worker, moved into, supervisory roles, and eventually into my role here. And I've worked in mental health. I worked in the mental health clinics, in our substance abuse clinics, as well as working inpatient and crisis services. So mental health in the Rockaways is something that St. John's is dedicated to, and being a primary provider of behavioral health services here on the peninsula. Thank you for having me.
Hi, my name is Hazel Phillip, and I am a licensed clinical social worker. I've been working in mental health for over 20 years, and with the Department of Health and Mental Hygiene for over a decade. The work that we do is really amazing in terms of engaging and working with members of the community, working with organizations that engage members of the community. The work that we do touch people from all different generations. So I'm so happy to be here today. So thank you for having me.
And thank you for answering the call. So we just want to get right into the crux of information, if you will. We don't want this to be too, stiff or stush, I guess is the best is the word. We do want this to be a relaxed conversation, because for far too long, the conversation on mental health has been passé, right? A lot of people don't want to talk about it until it's the time when it's necessary to discuss it. So we want to, of course, we have many people on Zoom that we are speaking to, and they're going to be engaging. So we want this to be interactive. With those on Zoom, please feel free to put your questions in the chat, and we will get to them. And those here in the audience, please feel free to think up your questions if you have not done so already. So we will be interacting with each other. But for now, if you can just briefly give an overview on, as it pertains to the work that you do, whether it's statistics, whether it is just everyday assistance that you hear, that you see, that you can provide, so that we can take away just some basic information before we get into the crux of the questions.
So here at St. John's, we actually have very robust behavioral health services. We have psychiatric services in our emergency room, as well as we have 2 adult inpatient units located within the hospital. And on the outpatient side, we have a very large clinic program. We have a IOP program, which is an intensive outpatient program. And between those 2 programs, we service 26,000, we provide 26,000 visits per year in those 2 programs. In addition to that, we have funded children's programs. We have a home-based crisis intervention program. That program is a really unique program that we've actually partnered with DOH MH for over 30 years, who provides us with a grant for that program. And it's an intensive in-home program for children at risk of psychiatric hospitalization, and it's designed to prevent the admission. We also have non-Medicaid care coordination, also funded by DOH MH. And we have a very unique program, which is relatively new to New York State, but such an important program is that we have family peer support services. And those are really important programs. We've learned over the years the value of having peer support, and so that families and individuals are not just working with professionals, but they're also working with people with lived experience, people who've walked in their shoes, right? Who can give them real-time, real-life advice, advocacy. And so we've invested, to be able to provide those services here as well.
The Office of Crisis Services provide oversight to many crisis programs in the community. For example, we provide oversight for mobile crisis teams. We have 19 mobile crisis teams servicing all 5 boroughs. Also, we have crisis respite programs, which provide services to individuals with mental illness and those without mental illness. So Crisis Resident Service provides services to people who are in a behavioral health crisis, and they prevent hospitalization. Another service that Office of Crisis Services provide, we provide oversight with the NYC WELL program. NYC WELL program provides information, referrals, they provide suicide prevention, they provide brief counseling in over 200 languages. So those are some of the programs that we have that can really support families here in New York City.
Thank you very much, as that is helpful information, and I'm sure our audience here is taking notes and writing it down, and towards the end we'll give more contact information, concrete websites and things of such that we can go back to and refer back to. Council member, I know you may not be ready, however I would like for you to just speak to some of the work that we do in our office as it pertains to when constituents and members of the community reach out to political offices, because sometimes, folks feel like, oh, politicians, they're just a load of crock, right? They don't do anything. They don't do any work. But we actually do. We do a lot of work. So if you can please share from your years of being a staff member and now being in office, what does that mean as far as mental health and how we support the community?
No, absolutely. Thanks for that question. I will say that I have seen a progression of the conversation around mental health. As I said in the beginning, we've started to destigmatize the conversation. Largely in communities of color, you often hear people saying, "Oh no, don't talk about this type of stuff," or they may say, "Go and talk to a pastor or something," which is fine if that's the path you want to choose. I know for myself personally, mental health was always a conversation that was introduced to me as a serious thing. So as a child, I remember my dad saying, don't talk about mental health if you're not serious about it, right? So it's not something to play about. It's something that's really serious. Mental health is something that has led to, in my own family, a cousin of mine committing suicide. And so it is something that at a very early age, I was taught that it's a serious conversation. And I probably should remove my mask so people can actually hear me a little bit better. I wear the mask like a uniform at this point. But in the context of elected officials' offices, oftentimes people reach out to their elected officials because they don't know where else to go. Or that's a starting point, knowing that your elected official will figure it out or help you figure out where you can go for help. And as now an elected official, my staff knows that when people come to our office, or whether they call us or email us, we are there to serve. Everyone that I've hired, I always tell people this when they were interviewed, ask the question, do you have a servant's heart? And that's because that's what I lead with. And then it's important to have a team that also has that same principle. And so what we do is when people call our office, two things. One, the staff, we do trainings. So we work with community organizations or experts in this field, and we allow them to come and train the staff. How do you handle someone who's going through a mental health crisis? What are some of the resources available so that we can approach it with a level of sensitivity that's needed? Also, we have prioritized mental health issues in the budget in the city council so that resources can be available across the city, but especially in the 31st Council District. And so what we work to do is we work to connect members of our community to the services. So our staff are not licensed or trained to provide mental health counseling or guidance or to diagnose anyone, but we are trained to be able to connect people to the resources that exist, like yourselves. And so, I'm really happy that the conversation continues and, that it's being approached with the level of importance that it deserves.
Thank you so much. And just to move into some of the crux of our conversation on tonight, the main question, how do we tell when someone is in crisis? We are not, as the council member said, we are not trained professionals. We are just everyday people, seeing someone having a moment, or seeing someone, speaking differently than they normally would. What is the best way for us to understand or see that this individual is in crisis?
I think one of the things that family members, friends, neighbors can notice is, really changes in behavior, right? Changes in mood. The person or the child may not be functioning well in school or at work. You may hear a lot of talk about self-harm or self-harm behaviors like suicide, talking about suicide. You may also see changes in weight gain or weight loss. So those are some of the things that you may notice that this person is experiencing. And I think it's really important to really reach out and have a conversation, because I think after COVID, people feel so isolated. We're seeing a lot of issues with depression, because of isolation. So it's really important for us to reach out and ask questions, or just reach out and be there for an individual.
I would piggyback off what Hazel was saying. So, to your point, you were saying that, people aren't necessarily professionals, but what you are experts in is your friends and your loved ones, right? You're experts in who they are and how they behave and what they, how they function. And so looking for those changes in behavior is really very important, especially if it's sustained over a period of time. In addition to some of the signs and symptoms that Hazel spoke of, you can also look for insomnia or too much sleeping. But after post-COVID, besides depression, there's a tremendous amount of anxiety. People are feeling a lot of anxiety for many different reasons. And a lot of times that comes up in changes in sleep habits, again, changes in eating habits, but also just kind of a sustained agitation, trouble getting along with other people, wanting to be isolated, wanting to be alone. And of course, the most significant change can be thoughts of self-harm. And that's obviously some of the most serious. And so I think that you're right. I think that reaching out and having the conversation, right? Starting to ask the questions. I think whether you're a professional or a family member, opening the door by saying, hey, I've noticed some changes in your behavior. What's happening for you? It seems like something's going on for you. Just that little opening can give that person the opportunity to share what's happening.
Absolutely. And just in going through, let's kind of role play a little bit, right? So in going through that, right, if that works, if that person says, yes, I'm sad, yes, this is happening right now, and they're open to discussion, that's great. And then you can have, a great discussion about that, correct? Would you say? Now, what if it goes wrong? If there is an individual, a family member that is not interested or is angry or has a negative reaction, doesn't want to seek help from all of those things that we've noticed, what is the next step for us as everyday people to try to assist our loved one?
Sorry. Go ahead.
I think it's important for family members to know where the resources are available, somewhere that they can reach out. And I always want to say that NYC, while It's a service that is available to all New Yorkers. It's free of charge. Folks can just call NYC Well. And I think what is important is that you know what is happening. You don't need to know what services you need, but just be able to give the counselor or the peer information about what is happening to your loved ones, and they can help you in terms of getting you connected, giving you referrals where you can speak to a behavioral health professional in your community.
So I would agree. And there are some, we spoke about depression and anxiety, but oftentimes somebody's experiencing maybe a more extreme mood swing or some psychosis, so where they're disconnected from reality. And those, can have there can be a lot of factors that play into those behaviors and those symptoms. But oftentimes people who present that way are not necessarily insightful about how they're feeling. People who are depressed often know they're depressed because they don't feel good. Right? But people who are maybe not depressed but having racing thoughts and feeling pretty good about themselves maybe doesn't quite understand that their behaviors have changed. So I would agree to reach out as a family member, to reach out to organizations such as NAMI, which is a fantastic organization. It is a nationwide organization that can really help families navigate through an individual or family member's mental health crisis.
Thank you so much for that. So let's say, okay, we're just going to take our role play a little bit further. If the individual, the loved one, is presenting with some abusive behavior, a lot of times we as a community may know to call 911. Mm-hmm. We call 911 for everything. I hurt my toe, 911, but in some situations where our family member is presenting differently, we're a little bit hesitant to call 911. And so if we don't necessarily want to call 911, I know you spoke of NAMI. What in the community here? I know you mentioned, Terri, you mentioned, I want to call you Dr. Terri so bad. This has been happening all day. You mentioned something about a crisis center here. And so can you just speak of on the Rockaways and in, District 31, what is the local, place that we can go to and contact?
So in terms of what we do provide a home-based crisis program that is specifically for children and adolescents who are at risk of psychiatric hospitalization. And really, that program is actually free of charge. It's open to anyone as long as the child meets criteria for admission. In terms of other crisis services, I know that there's sometimes often hesitation to call 911, and there's been a lot of really valid reasons why people would be concerned about
especially
calling 911.
People of color. We have many instances where, you have autistic family members have been killed, and this is not, of course, this is not everywhere. But we do have that. And so, I will say, as this is a conversation about people of color, we are very hesitant to call 911 and to even call intervention services. So if you both can just speak to, that as it pertains to people of color.
Yes. So I think one of the really wonderful services that we have in the city is mobile crisis. And I recommend calling 911. NYC Well, because NYC Well can connect the individual to mobile crisis if they meet the criteria for mobile crisis. And that is, as some of the behaviors that was just explained, if the person is experiencing an extreme behavioral health crisis, they're refusing to seek help, even with assistance from a family member or friend. Mobile crisis would be appropriate for that person, as long as the person is not in imminent risk of harm to self or others. Mobile crisis can intervene. They respond optimally within 2 hours. Okay. So that makes the service ideal for people that is experiencing a crisis in the community without reaching for 911. As the first option.
Okay, and if you can just explain a little bit more about what, so it's New York City Well mobile crisis?
So NYC refers people to mobile crisis teams, which is located in different CPAPs, hospitals, and community-based organizations.
Can you tell us lay folks what a CPAP? I heard guys talking earlier. They have all these cool acronyms, and I'm like, what is that?
You know, we're terrible in terms of not speaking like that, and we shouldn't be speaking like that in public. But it's the Comprehensive Psychiatric Emergency Program. Got it. Yes. So basically, an emergency room that has this mobile crisis component to it. We have currently 19 mobile crisis teams, 5 of which service individuals up to the age of 20. And we have the other programs service individuals from 21 and above. Okay. And these crisis service operates from 8 a.m. to 8 p.m., holidays, weekends. So it is available for folks in crisis. After hours, NYC will work with the family member or the friend to find the next appropriate services if a person needs to be responded to immediately.
Great. This is such great information. Like, I'm learning so much and very excited. And I hope that our members in the audience and on Zoom are really taking notes. But if you are not, we will have this information readily available in our office. Terri, if you can just explain to everyone what NAMI is.
So NAMI is the National Alliance for Mental Illness, and it is a peer-run organization of family members, right? So it is self-sustained. It is a nationwide organization. They provide some fantastic supports for family members, both people who have mental illness and those with substance use disorders. They have classes you can take, including a family-to-family class, which really helps people who are living with somebody who has a mental illness learn to kind of negotiate, what's going on at home, understand advocacy skills, understand the disorder, understand, how the systems work. There's like a fly buzzing around.
You see us fighting him over here.
Sorry. And there is chapters in Queens. And in addition to that, here at St. John's, we actually, for our patients' families who have been admitted to one of our inpatient units, we do outreach them to provide a similar family support group that meets on Saturdays once a month. And it's really an education/support group. And we started it about 6 months ago. And since that time, 45 families have come through the program, really kind of learning the skills to be at home, to understand kind of their new reality, and helping their loved one recover and stay on the path towards recovery from mental illness, plus getting the support from one another, which is so important. Yeah.
Thank you so much. That's such great information. And as we just dive into information for people of color, I mean, obviously it's for everyone, but because mental health has such a stigma in our communities, as the council member said, that we as a culture, the culture is to pray about it. The culture is to not talk about it. Let's keep it inside the family. And so therefore going to therapy is passe. Thank God it's, coming out. We're hearing more and more about it. If you both can just discuss therapy, what that looks like. Sometimes people feel like, okay, I did therapy for 3 months. I'm good. Thank you. This was great. I feel better. But if you can just give your from your work that you do, therapy, how long should it be? It depending upon the issue, of course, it's different. I'm an everyday person, but I might need to talk about some things. Talking to my friends is not working. So, therapy, how long should it be? What should we be doing? What type of therapist should we look for?
So those are really interesting questions, and there's not a single answer to that. There are people who go to therapy for 3 months and they do feel better. right? They were dealing with a specific, maybe traumatic event that happened, and they go through very specific protocol of like cognitive behavioral therapy that helps them manage the response to that trauma. And then there's some people who have longer term, deeper concerns or issues related to more systemic trauma or abuse or more long-standing depression or anxiety that may require therapy over a long period of time or some combination of therapy and medication. And there are some mental illnesses that require probably a lifetime in some sort of mental health treatment, because some mental health disorders, just like some health disorders, are chronic, right? So we talk about things like schizophrenia, some versions of bipolar disorder, where over a course of a lifetime, people will probably have to come in and out of therapy and have medications. So it really depends on the individual. In terms of what you're looking for, and specifically talking about like the role of culture and diversity, any provider that you're going to, right? And I know this is true for St. John's. We spend a lot of time here, and I know our Human Resources Department, and as a strategic priority, that our team members represent the diversity, the cultural diversity, the ethnic diversity, and the racial diversity of the Rockaways, right? That is important, right? Not every person who comes into the clinic is going to necessarily need or want or request a therapist of a certain background or nationality or culture, but we have to have that available, right? And so we're very cognizant of the fact that we need to have a diverse mental health team. Second to that is when you're walking into a program for the first time, you should expect that you have a very open discussion about culture, because culture is strength, spirituality is strength, right? Family dynamics is strength. And so any time you're working with a therapist, they should be looking at those things with you, harnessing those strengths. That's the pathway to getting better. And that's what you should be looking for when you go into therapy for the first time.
Thank you. Ms. Hazel?
Yes, I want to echo everything that you just said, but I also want to add, how do we empower our community to be able to ask questions and to make decisions about our own healthcare, to take responsibility for our healthcare? How do we do that? And I think it starts with working with people in the community and meeting them where they are in terms of asking them what they need, which will help to empower them. So I really think that empowering our community is as important as the government or other systems putting systems in place that would ensure that we receive equitable health care.
Thank you so much. That was definitely helpful. As a community office, a city office, can you, and we have some other areas of government on our Zoom. We have a state senator on the Zoom. We have our, I think the congressman's office is on the Zoom as well. And so I would love for you all to just give an idea of what do you all think, and from your work, what do you see that we can do as an area of government and agency, with Ms. Hazel being from, New York City, the stigma of the city not necessarily supporting. What do you think and what do you see in the future? How can we help as government agencies to support the community?
I think one of the things that we are doing is asking the community what they need, providing surveys and getting information back to get an idea of what the needs of the communities are. I think for too long we have been basically given the community what we think that they need, but not really asking. And I think we need to change our behavior in terms of, in order to reach people, we really need to ask what they need and to go through that process.
Got it. Thank you so much. Terri.
From my perspective, and certainly with the governmental agencies that in my role I deal with a lot, which is DOH, MH, and the New York State Office of Mental Health, has always been very, very supportive of behavioral health services here in the Rockaways. And I know we talk a lot about expansion of those services, and we have always received support. I think that you're right, Hazel. I think that we need to ask people what they need. We can't assume that we understand what the needs are. We have done, at the hospital, we've done a very extensive, community health needs assessment, and responding to those, to the prioritized needs, not our priorities, but the community's priorities around women's health, around behavioral health, around substance use, and as we build our strategic plan and as we build our priorities going forward, those are all based on the responses and the feedback that we get from our community members.
Thank you so much.
And one of the things that I want to add is, looking at social determinants of health and addressing those issues, it's very difficult for folks to take care of their mental health and their physical health if they don't have food, if they don't have somewhere to live. So we need to look into these things and address it while we take care of, work with the community to take care of other needs.
Absolutely. So basically what I hear you saying, just want to state that, is that we must take care of the basic needs of the community first, which will lead to the mental health needs of the community. Correct?
Absolutely.
Okay. And so, Ms. Terri, Dr. Terri, soon to be Dr. As it pertains to here in the Rockaways and in District 31, and all the work that this hospital, which technically is the only hospital here in the district, and the support that you all see around the community, how can we partner with your organization? I mean, yes, we were able to have this amazing event today, but moving forward, what would you like to see specifically in our community to support our community as it pertains to mental health?
So I think that it's important that that the community be involved in all the opportunities that we provide to be involved in the decision making around St. John's, right? Community health, the Community Advisory Committee. We have a PFACT, which is a Patient and Family Advisory Committee. We have a specific PFACT for behavioral health made up of patients and family members, right? And participating in those committees is really vital. Recently we just got Plane Tree Silver certified, which I know that you are aware. For those of you who don't know what that is, Plane Tree Silver is a designation that only 6 other institutions have ever reached in person and family-centered care. And part of the way that we got there was we took our family members, we took our patients, right, and we embedded them on committees, on our performance committees, on our quality committees, on our decision-making committees, so that as we work to improve our services, improve our care and respond to community needs and build new programs, it's based on what the community is telling us.
Absolutely. Thank you so much. This is such amazing wealth of knowledge that we are receiving today. And so we are going to open the questions up to those that are on our Zoom, as well as to those in the audience. So there is a mic here. If there is anyone that is in the audience that would like to ask questions, please raise your hand. Sure.
Hi, thank you. Hello, good afternoon, good evening. So as a licensed clinician, I work for Sheltering Arms as a division director for youth services. Oftentimes, young people between the ages of 19 to 21, or even 18 sometimes, are experiencing their first psychotic episode.
Yes.
And oftentimes, the family normalizes that behavior and don't identify, just based on cultural practices and beliefs, that this is a psychiatric issue. What would be your recommendation with working with those individuals and families?
So that is a very, very challenging population to work with. On the one hand, it's terrifying, right? It's terrifying for the family member. It's terrifying for the person who's experiencing like a first episode psychosis, because what we do know is that psychosis tends to begin to manifest itself sometime around between 19 and 30, depending on the person. And I'll speak as a parent for a second here, right? Nobody wants to, when we see things for the first time, nobody necessarily wants to embrace the idea right away that my child might have schizophrenia or might have bipolar disorder, right? We love our kids. We want them to have good, happy, fulfilling lives, and it's terrifying to think that they might be sick, whether it's through mental illness or medical illness. We don't want our kids to be sick. And then you have the challenge of also working with the individual. Right. But the other side to that, and by the way, Sheltering Arms is one of our partners. I know you work very closely with Kathy Gardini, so we appreciate the partnership that St. John's has had with Sheltering Arms for quite some time. It's so important for that age group to get treatment early. And I don't think everybody quite understands that when you have a first break psychosis, there is a real opportunity to create a sustained recovery if we can prevent a second or a third break in psychosis, so another episode of psychosis. In terms of the brain functioning, that would be a question for a doctor, but we know that to be true. And so there are those first break psychosis programs. St. John's does not have one of those programs. We do have an intensive outpatient program, which can be really helpful and can provide many of those same services that first break psychosis program, can provide. I do know that Northwell does provide a first break psychosis program, which really helps individuals and families understand what's happening with the dynamics and the value of trying to figure out what's happening and managing it within that time frame. It's very challenging.
Hold on one second. I just want to thank Ms. Walcott for attending on tonight from Sheltering Arms. She is a great supporter of our office. Whenever I text her with our events, she definitely always comes. So thank you so much. And we have our district leader in the room. Thank you so much.
Hi, everyone. Hi. Thanks for having this forum. It's so essential now with what's going on with folks. But I've known of this kid, and while I'm speaking about this, I saw his mom yesterday, but this kid has been bounced around from school to school to school, and I hope he did get some help by now, but when the parent don't want to accept that something is wrong, how can you really approach that parent to say, I'm not criticizing your kid, and I mean, you do it in a private situation, but this child needs help. How can you approach that, something like that? So sad for the child, and I'm talking about someone who is about maybe 8 to 10. It's so hard.
It is so hard. I think that when you're working with parents, right, we need to come to some common terminology, right? We have to understand what their goals are. We don't, from our point of view, we may say, oh, that child looks like they might have ADHD or they might have this other disorder, but we can still find an agreement with parents and with family members, even if we don't agree that it's a mental health issue that may or may not requiring medication. right? We can come to agreement that we may disagree on why there's problems in school, but we can agree there's problems in school, right? We might, disagree on why there's misbehaviors at home, but we can agree that things aren't going well at home, right? So until we can understand the parent's point of view, empathize, and partner, right? Where we might not be able to get all the changes that as a professional I would like to see, but that's not, it's not my decision to impose the changes that I would like to see, but partner with parents so that they can get to a better place in having a better relationship with their child, right? If they're having not a great relationship with their child because they're fighting all the time at home, or maybe they feel like their child's not listening, let's just focus on those things, right? We don't have a child with ADHD, we have a child who has some trouble listening, and try to get to a better place starting there. Would you?
I totally agree with that. I think partnering with the parent is extremely important in this process, because oftentimes everyone wants to have a child that is healthy. And just going against that just makes the parents push back even more. So it's really important to try to develop that relationship and be supportive. I think giving them that support is really important, although they may feel that their child does not have, and we don't know for sure, right? We don't know what it is that is actually happening with this person, except that they're having some challenges at this point. So I think really knowing the language, not using terms that that might be stigmatizing, is extremely important.
And I think also that's where the value of having peer support and working with other parents who've had that lived experience, right? Because there is a credibility that comes when you're sitting with somebody who's had 10 years ago had the same exact life experience you did because their child was in 4th grade and they were getting the calls from the teacher, or their child was sent to the emergency room, right? That's where that credibility comes in. That's where that alliance starts to build. And instead of feeling criticized, parents can feel supported.
Actually, 2 questions. What can you do when someone is diagnosed and on medication but has decided for themselves that they're better and no longer wants to take the medication? How do you convince them to get back on their medication? And the second question is, what's the first step in finding a therapist?
So I think 2 great questions. In terms of finding a therapist, I would recommend calling NYCUL. It's like the easiest place for people to go that it's not complicated. You just need to be able to explain what is happening to you, and they would provide you with services that's available, referrals for services that is available within your community. So I think at some point we will put up the number for NYCUL.
Absolutely.
And I think in terms of the second question, if you could read that again for me.
Well, before we get on to the next question, the second question, if we are not in New York City, we do have a few people that are here, and I'm sure all of us may have friends outside of the city. If you're not in New York City, let's say one of the tri-state area, or I know you mentioned NAMI, but aside from that, where can people search?
Well, there's always, if you live in New York State, you can always call the New York State Office of Mental Health or look on their website. You can do a quick search. Every state has some sort of office of mental health that you can go to. You can also, there's also a federal database that SAMHSA has that you can either access by phone or online, and they can give you resources in any state.
So we got NAMI, which stands for
National Alliance for Mental Illness.
National Alliance for Mental Illness, and we have SAMHSA. SAMHSA. You see all of these acronyms. Listen, when I started working for the city, we were like, all of these acronyms. Oh my gosh. So SAMHSA is the next one.
SAMHSA is the Substance Abuse Mental Health Service Service Agency. It's the federal agency. I'm going to have to look up that acronym for you.
Got it. Thank you so much. Okay, the second question, Renee.
What can you do when someone is diagnosed and on medication but has decided for themselves they're better and doesn't need to take the medication anymore?
So I would start with what the worst thing that you could do when someone decided that they're better is to tell them that they're not, right? So that is really important to know. I think it's really important to provide the person with as much information as possible about health, about mental health, about ask them questions about, what they're doing in order to keep themselves well. Engage with the individual. But you cannot tell a person that they still need medication or they still need treatment. You really have to work with them where they are and provide them with as much information and support and encouragement as possible. But never tell them that they need to get treatment.
Yeah, I would definitely echo that. And I'll just tell like a little story for a second here. Not wanting to take medication is not unique to people with mental health issues. So I'll tell you my own personal story. I mean, we stop high blood pressure medication all the time. I don't know how many times have you gotten 10 days worth of antibiotics and you stop at day 7, right? I myself, I have rosacea. So, I get like redness on my face. I go to the doctor, he gives me the medicine. He says, you need to use this all the time, every day for the rest of your life. And I always stop as soon as that little redness goes away. So this is not unique to people with mental illness. This is normal human behavior to not want to be sick, right? And not want to take medication for a long period of time. It is an educational process and it's a long process. And they're not wrong, they are better. They're better because they're taking the medicine, right? Just like somebody who has high blood pressure and then they take their blood, I don't have high blood pressure anymore. Well, you don't have high blood pressure because you're taking the medicine. But I think you're right. I think that setting up a power dynamic in the house it probably won't end well if you're trying to force somebody to take medication, but to listen, to empathize. If they're in treatment, they might have done a WRAP plan, which is a wellness and recovery plan, which actually a person will do, somebody who's struggling with mental illness they'll actually list their signs and symptoms of when they're not doing well and hopefully share it with the family members. So that's something you can review with your loved one and say, I understand that you're not taking, you're choosing not to take medications now, but let's go through some of the things we need to look for to see if your symptoms start to come back. So there's a lot of things you can do to be a support, and you can still make your preferences known, that you prefer them to be on medication, while still empathizing and supporting.
Thank you so much.
So just one thing I want to add to that, WRAP plan is to be done when folks are well and not when they're symptomatic. So it's probably important for you to have the discussion about a WRAP plan prior to your family member showing symptoms of their illness, so that you have this roadmap and this plan that is tangible, that you can go to and work from to help the individual.
Okay. So before we get to our next question, I just want to make sure that everyone's following along here. So we must make a plan, right? So when we have our family members that are in crisis or they appear to be in crisis, if we're in New York City, we're going to contact NYC Well. We are going to discuss with them what is actually happening. We want to make a plan in our home, or if it's not the person in the home, in the community, that individual in the community, we want to make a plan. We want to work with, not against, correct?
Correct.
To be supportive, not authoritative. So these are very important key points that we must remember when supporting someone who appears to be in crisis, okay? And so then we have our next question by Mike, who is from Gateway Give Back, who I just want to highlight that we spoke on this afternoon, and he came right over to our event today. Thank you so much. What's your question?
Thank you. So I feel like in the neighborhood, I got like a good say so, and with the kids, and mental health plagues my community, especially, like not especially, but my community a lot. And I've seen kids go from playing football to the next day being so stressed because they ain't got school clothes and their mother's doing this and their sister getting, you know what I mean? There's a lot going on in their life. And I feel like I want to be able to help, but I feel like I can help. And how could somebody like me work with agencies like y'all to where I could get them to help with no problem? Like I get to know y'all, agencies to where I know what proper channels, so I don't just gotta call a hotline and go through those channels where I could work with y'all personally. How could somebody like me that has a nonprofit that just winging it just deal with y'all personally?
So for here at St. John's, please reach out to me. I'll be happy to bring you in, meet the, everybody who works in behavioral health. You can meet the entire leadership team. As you're talking, I hear you down the road partnering with our child and adolescent programs, which do a lot of things in the community as well. You may have interacted with them, much like Sheltering Arms has, as we do a lot of different community events and are very proactive. So it's really just I'll give you my card when we're done, and we can absolutely set up some time to have a conversation.
Yeah, I'm thinking about, I think it's best, we do have community-based organization that's available to work with individuals in the community to basically help them be able to help others that is in this type of situation. So I'm also going to give you my card so that you can reach out to me, and I will connect you to the right people that you can have a conversation with.
Thank you so much. And also, as we discussed, I'll just say it for everyone here, definitely communicating and partnering with your elected officials. That's what we're here for. I know, we discussed this earlier, but a lot of people don't really understand all the time what elected officials are here for. And this is it. For community events, for community outreach, for resource. Each and every one of our offices, whether it's the councilwoman, the state senator, the assemblyman in your area, and that's just not specific to New York City. That is actually everywhere, which a lot of people don't know. In some places it's called an alderman. It's called, your mayor's office or something like that. But you can contact them for resources and community information, okay? And we have another question from the Zoom.
Diet and mental health, is there a correlation?
So what I would say is that I think what that kind of touches on is the social determinants of health, right? So while it is really important that we keep a good diet, right? That is important. I think that when we talk about social determinants of health, if we talk about people who don't have access to good, healthy food. Not that they're not choosing to eat good, healthy food, but they don't have access to good, healthy food, right? They don't have access to some of the basic needs to feel good, to feel less stressed in their lives, to feel like they are able to pursue a healthy life. That inevitably connects with issues of depression and anxiety, right? It feeds depression and anxiety. Right? If you're stressed about making, groceries at the end of the month, I can speak from personal experience. I grew up as a, single mother, 4 kids. We were on Medicaid and food stamps, and I remember those getting to the end of the month, and there was my mother being extremely stressed. And so that inevitably leads to depression, inevitably leads to anxiety that doesn't necessarily get relieved when the financial crisis is over either. So I think this is why it's so important that we invest in social determinants of health, right? We can't expect people to feel good and not be depressed when they're having financial issues. And I think that's where the issues around population health, and that's for medical health as well. How do people prioritize getting cancer screenings right? If you need to prioritize rent and food. It's very hard to do.
Yeah, absolutely. Investing in communities, right? Extremely important. And I think that would get to employment, education, right? People have jobs that will pay them livable wages. Food insecurity is a real thing that needs to be addressed. This is the United States of America, and folks are hungry. Children are going to bed hungry at night. So those things need to be addressed in order for us to be able to deal with other issues that our communities are faced with.
Absolutely. And I would just like to add to that, that I've seen a lot of community-based organizations in the, District 31 community that does a lot of work to support the food insecurities here, whether it is distributing food to the hungry or distributing food and not necessarily having folks to come and take the food, right? So we must make sure we get the word out about all the community work that we all are doing, and share it. Let it not be a secret. This event here on tonight, was a wealth of knowledge that everyone has received. So all of us that are hearing, we must have the task or the homework of going and taking the information that we learned tonight and giving it to at least 5 people, whether it's 5 community-based organizations, whether it's 5 friends, 5 family members, just sharing the information that you've received and not just keeping it to yourself. Because we are all doing a lot of work and we want to make sure that those that are in need are getting the assistance. I believe we have another question here in the audience.
Hello again, everyone. So I do have a question about FST family therapy, particularly with the specialty, particularly in therapeutic settings, of working with juvenile justice involved youth or high-risk youth. And so I definitely feel like this cohort or population of young people who we definitely service at our Fair Violence Program it's not a transitional relationship to begin with. And so therefore requires trained expertise working with and having the cultural competencies in place to work with this set of young people who have all different types of external and internal things happening. Are those things available in Far Rockaway? In terms of, is there any program that specializes in working with this specific population?
Specifically with those who are criminal justice? So I
really can't speak to those
sure.
programs that deals with that population, unfortunately. I can't, no.
So we'll research that. We'll work and kind of check in, and I'm sure you'll ask your colleagues, both of you, and then we will get back to you. She's always tripping me up with the questions and thought-provoking ideas. Absolutely.
It's a very good question.
But I know, as you stated, NYC Health, if you can, check with them, and we can give you one of your, program coordinators with NYC Health to kind of work with Sheltering Arms and Rock Safe Streets, which is here out in District 31, and our Cure Violence organizations here in the district to support them with mental health issues.
I think what you kind of both are touching on, though, is really the crisis for mental health with adolescents. And that's what I hear you both. I mean, it's not, and that's not unique to Far Rockaway or to New York. It's a nationwide crisis. We had a crisis of mental health for children and adolescents prior to COVID, and since COVID, it has skyrocketed. There's not an emergency room that doesn't have adolescents who are suicidal. I personally, in the 20-something years I've been doing this, I have never seen so many adolescents presenting with suicidality, and it's terrifying. I think as a country, we're just beginning to come to terms with what are going to be some sustained and long-term mental health consequences for our youth related to COVID.
Well, and not just COVID, as Ms. Walcott was explaining. there is, especially we're speaking of people of color today, and we must acknowledge the fact that the climate in our country right now, as it pertains to Black and brown men and women, our children, our adolescents who are growing up watching this, seeing this, and they are nervous. I know some schools are teaching, may have different books. I know there's a book called I believe it's Martin and I, or I Martin, where it talks about police brutality and pulling over a young student, and the abuse between the world and me by Ta-Nehisi Coates speaks to it. There was a documentary film, many documentaries based on it, and so it is at the forefront of our children's mind, and so we have to acknowledge that it is something there. And then on top of that, COVID, which I have seen, and my son is in middle school, as well as many of the high schools in Long Island in particular, have seen a rise in not just suicidal thoughts, but actual suicides. And so, with us being parents, with us being community organizers, yes, we have NYC Well, and we can bring them into our schools, into our organizations, which I'm sure that is something that, the Department of Health here in the city, as well as the state, is open to doing. But if you both can just speak to just the best way to speak to our children, to calm their fears, to calm their anxieties as they are looking out their windows, seeing, gun violence every day. How do we as parents, family members speak to this? And not just dial or call NYC Well, because sometimes it's like when my son is in crisis, I can't pick up the phone. I just have to talk to him right then and there.
So I think you're touching on what happens to people when they are subjected to differing, sustained traumatic events. Right? When it becomes part of your everyday life. So there's different types of trauma, right? There's the trauma of, I got in a car accident, right? Or I saw one terrible thing happen, and one terrible thing happened to me, and that is very traumatic. And then there's the impact of sustained traumas, right? So the impact of the trauma of systemic and prolonged racism, police brutality, COVID added on to that, right? Which created a sense of not feeling safe. And it definitely is, and I'm sure it's very challenging for parents who also probably don't feel that safe, right? To then provide comfort and safety to their child. But that, that's really at least initially, the path forward in helping your child to feel safe at home, to feel safe with you, to be able to openly talk about what the impact has been on them. When you mention books that specifically address this, it can reduce that sense of isolation, or I'm the only one afraid of this, and also create a sense of empowerment, right? So not just what we're scared of, but also the protests that went on, and bringing your kids to protests, and making sure that they understand that there is empowerment also in protesting and making your voice heard. And it doesn't just have to be, being scared and your anxiety, but we can do something about it.
Thank you.
No, I heard your question, and I was thinking about my own trauma. So I would honestly say to you, I don't have an answer for you, because I have to deal with my own trauma, and I don't know exactly how to tell you how to support your child except to be there for your child. Just as my social support and my loved ones, we're there for each other, because I'm trying to work through this myself.
And that's real.
That's real.
That is definitely real. And
that's why organizations like what you're doing is so important.
Absolutely.
Right? The support from even outside the family.
Right.
So important, that what you're providing to the community.
Sure.
So my nonprofit is Give and Give Back, right? My neighborhood is Give. So it's not like Rock Safe Streets, where it's like, Rock Safe Streets is like the whole Far Rockaway. So it becomes like very general. It's big. It's on a big scale. So mine is like more condensed to my neighborhood. So I wanted to make it like a trend to where I could just focus on my neighborhood, like my 5-6 blocks, and help with the parents and the kids that I can grab up and bring them to therapy, or just to talk. Like, yo, bro, come on, let's go. You need help, bro. I know you need help. I can tell, but like, just come me over here. Like, it'll be cool because you safe with me, and I'm cool, so you good. I feel like the parents is where I feel like I would start at, because I feel like a lot of parents don't know they need help, or they just don't look for help. They just like they good with who they are or whatever, but they need help and they don't know. So I feel like if I help the parents without them knowing, or without, because when I do my give back, I give back, and I spent $10,000. I got a lawsuit, I took $10,000, I just gave it to the neighborhood, and the looks on them, the mothers' faces, they was just so happy. They was grabbing stuff and the haircuts for the kids, and it was like they didn't even notice that they needed it, but it helped them, and at the same time, it helped their kids. You know what I mean? And then the kids don't know they need it at all, because when I was going to school, I told her, one pair of jeans, I went to school without a shape-up for the first day of school. Like, I didn't know I needed a hoodie, a new coat. My coat was bitten up from my cousin. I didn't know I needed help. So for me to give help, it was straight to the parents. And then that could take some away anxiety and all of the mental breaks, depression and everything that could cause mental health. But they don't know they need it. So if I could focus on a smaller scale, it might help. That's just, what I could say.
Thank you so much. That is a wealth of knowledge right there. And that's why our community-based organizations are very important to us. As he said, he's just in Gateway, which is right outside the block up the street here, and so it's important that each community have that. Someone like Mike, or, any community, Jamaica, Edgemere, Arvern. It's important for our community to support each other. As Ms. Hazel said, her community base is what got her through. And so isolation is not helpful. We are beings that thrive in social settings. So we must speak to each other, even if it's just that hello to someone walking down the street. You never know how that could have made that person's day. Yes, we have Instagram, we have social media, which is not really that social, right? Because it makes us stay in our phones and not interacting with each other. So it's very important for us to stay social. As my partner has told me, I need to put my phone down, stop answering, replying back all the time. And it's very important for us to have support like that in our lives, because that is what keeps us going. That's what holds the mirror up to ourselves. So we appreciate the Mikes in our community. We appreciate the Lenores in our community that support community-based organizations that support a community at large. And we have the council member who has returned to us from doing so much work to kind of help us wrap it up on tonight. So each of us here on the panel, excluding myself, if we can go down the row and just give our wrap-up remarks. You want to start, Ms. Terri?
So again, thank you so much for having us. I know St. John's was really happy to host this. I've been passionate about behavioral health. I'm a LCSW. This is what I want to do since I was 19 years old.
Acronym. What's that acronym?
Licensed clinical social worker. So what I do have to say is in the 20 plus years I've been working in Rockaway, we have seen a greater investment in behavioral health services. It's not every place it's not everything we want it to be yet, but we have seen a sustained investment. And that investment has come from here at St. John's internally. It's come from our partners in city government and in state government. It's come from our regulators in DOH, MH, and OMH. And I look forward to what the behavioral health landscape of Rockaway will look like over the next 10 years, because I think we're going to see significant investments. And I appreciate everybody who got onto the Zoom call, who sits here tonight, who sits on our Community Advisory Committee, who sits on our Behavioral Health PFAC and our regular PFAC, because without you as partners, we could not be doing what we do and continue to work towards improved community health outcomes.
And thank you so much for answering the call. And of course, St. John's for opening up the room, even when some of the doctors were like, we're supposed to have a meeting in here. And we're like, no, you're not. We have an event. So I definitely appreciate St. John's and Zuleika and even Henry. I must acknowledge Henry, who is in the back, who none of you guys can see. Henry is our AV team that St. John's has allotted us on tonight, and I just wish I can have Henry at every event. The council member is laughing because she knows it's normally just me trying to do all the things that Henry is doing right now. So I just want to let you know that as St. John's gave their final remarks, I do appreciate Henry and his team on tonight. Ms. Hazel.
Yes, I just want to say thank you for invited me here. I think events like this is so important to empower the community. Education is power, and it will continue to be. Having this information will help folks in the audience here and folks here, hopefully, to be able to have the information to support their families, their friends, people in their community. I think it's important for us to be able to work together. There's a lot of intergenerational trauma that we need to work on. And I think empowering us and having these gatherings is really important. So thank you.
Absolutely, and please look forward to receiving many calls from us so that NYC Well can come out. And I mean, we already called the Department of Health, but I definitely look forward to reaching out to NYC Health. And before the NYC Well, before the council member gives her final remarks, I just want to reiterate the takeaways from tonight, right? I don't know if you guys are writing, but we just want to make sure we're telling 5 friends and family members about the information that we received on today. We're letting everyone know that there is NAMI. NAMI is, the acronym stands for, say it again.
National Alliance for Mental Illness.
Thank you. And it's national. So if you have friends in other states, you can let them know about that information. As far as New York City is concerned, we have New York City NYC Well. Yeah. NYC Well, so you can go online. I'm sure there's an Instagram, a Facebook. You can call.
And you can chat.
Absolutely.
With NYC Well to get. For brief crisis counseling, they do that. For information, brief crisis counseling, information and referral to behavioral health services, and also social determinants of health services like food pantries. Places where you can get housing assistance. So those information are available on NYC Well website, and of course, as I said, you can call, you can text, you can chat, or you can just go on their website and search for resources.
Absolutely. And as it pertains to therapists, which is what we discussed today, you can find some therapist information through NYC Well. And last but not least, we have our state, each state, which is what we mentioned, each state has a mental health department. So please, of course, we know New York State has one. We have our city here, but please feel free to look up the New York State in your location or whomever you would like to support with mental health as it pertains to mental health. And last but not least, of course, our office. The Office of Councilmember Selvena Brooks-Powers, who is here with us today. We do provide information as well, but I will let her wrap that up.
And thank you again, everyone, for coming out today, for tuning in tonight to this important discussion. Thank you, Vanessa, for being the facilitator with the mostest. And give her a clap.
Great job.
As well as our panelists for sharing all of the wealth of information that you all have And thank you once again. I can't thank St. John's enough. I saw they have goodie bags outside for everybody and everything. So those who are tuning in, you're missing out on the goodie bags. But, we want to continue to facilitate spaces like this, safe spaces, so that the community, especially the BIPOC community, is able to understand what resources are available as it pertains to mental health, and know that you have a community that surrounds you that wants to support you. And we'll continue to prioritize in legislation, in funding, resources, to make sure that, there's things here that can be accessed when in need. And so, again, thank you for coming out, and everyone get home safe and stay safe. Thank you.